He was born at 28 weeks. He was 2 pounds 2 ounces. I called him a little baby bird because he was so frail and just looked like paper. If they're premature, it's like they're still in the womb. They hear your heartbeat, you know, they feel you breathing. They had all that when they were in you, and so you're providing the same thing to them that makes them feel more comfortable when they're out of the womb. And that's what the Skin2Skin basically is for, is just to make them feel like they're back in there again. So when they're preemies, that's what they need.
Hi, my name is Ariana Kassler. I am a nurse in the Riley Newborn ICU. I've worked here for 16 years. Today I'm going to tell you about Skin2Skin care. Skin2Skin care, also known as kangaroo care, is a special way to hold your baby. During Skin2Skin, a parent holds their baby next to their body, allowing the parent and baby skin to touch for close contact and warmth. Your baby will only wear a diaper and maybe a hat. This is the best way to hold your baby. Skin2Skin is a part of your baby's care that only you can do. When you hold your baby skin to skin, your baby is reminded of what it was like in the womb. He hears your heartbeat, is rocked by your breathing, recognizes your smell, is warmed by your body as you hold him securely. It's familiar, reassuring, and calming for your baby. And babies usually go to sleep within minutes of starting Skin2Skin.
It's a good stress reliever. I mean, if you're in here in the hospital all the time, you don't really get to hold them. That 1 hour a day that you do get to hold, it's like when you get done, your stress level's way down, you're kind of half asleep because it's so peaceful. And it's like, you feel really good afterwards. You watch up, you make sure you don't have any colognes, deodorants, anything like that on the front. No chemicals in the shirt, otherwise it can irritate the baby. You walk up to the isolette, position the baby where she's lined up with you, so you just bend over and just put your hands under and gently pick her up as you're bent over. You don't want any large gap, that can scare her. As soon as you pick her up, she instantly calms down as soon as she feels that skin, because she's familiar with the smell and the texture of your skin. Don't be afraid. Don't be afraid to pick the baby up and hold him, because it's one of your chances to do an early bonding with the baby.
Holding your baby skin to skin has many benefits for both premature babies and those born at term. These benefits include reuniting baby with mother or father, promoting a regular heart rate, promoting regular breathing, improving oxygen levels, increasing sleep time, improved feeding tolerance, better weight gain, better mental and motor development, and more successful breastfeeding. Parents benefit as well, improving bonding and a greater feeling of closeness with the baby, reducing stress and anxiety, and an increased confidence in your ability to care for your baby. Skin-to-skin care also increases the mother's breast milk supply and is one of the first steps to breastfeeding. By now you're asking, when can I start? The best answer is when your baby is medically stable for Skin2Skin. However, if your baby is not stable enough to hold, you can still hold your baby. Your nurse will show you how to cradle your baby's head and feet with your hands. To prepare for your first Skin2Skin session, talk with your baby's nurse and become familiar with your baby's cues. Even if your baby is on high ventilator settings, talk with the doctor to see if your baby is stable enough for Skin2Skin. When performing Skin2Skin, make sure to wear a clean blouse or shirt that opens in the front. It needs to be big enough to close around your baby, and you can wear a hospital gown if you like. Make sure not to wear perfume or aftershave or smoke before starting Skin2Skin. Also, you cannot have a rash or sores on your chest to perform Skin2Skin. While performing Skin2Skin, you can hold your baby for at least an hour, but more is better. If you can hold your baby from one feeding to the next, that is good, but not necessary. And remember, your baby can be fed during Skin2Skin. If you can, do Skin2Skin every day. While holding your baby, take the time to get some rest and let your baby rest too. If your baby is awake and alert, Talk softly to him so he can hear your voice. Before performing Skin2Skin, you'll need to make sure to eat and use the restroom. Also make sure you've washed your hands. If you are pumping, you may want to pump before starting Skin2Skin. The nurse will help you with the chair and getting your baby ready. The nurse will also help with any tubing and cables, check your baby's temperature, and make sure his diaper is clean. Your baby will then be put on his back and turned so his feet are facing you. Your nurse will help you pick up your baby and move your baby from the isolette to the chair. In preparation for holding Skin2Skin, the nurse will adjust the isolette height and you will stand in front of the isolette with your shirt unbuttoned. You will put your hands under your baby with one hand cupping his head. A respiratory therapist will be on hand to take care of any ventilator tubing, and the nurse will handle any other lines and cables. You'll then lean over the bed and rest your chest on your baby's chest. Then gently stand up with your baby. You'll want to stand for a minute so the respiratory therapist and the nurse can adjust any tubing. Then slowly walk to the chair. Remember, the nurse and the respiratory therapist will be there to help you. After you are sitting comfortably in the chair, any tubing will be secured to your shirt with a safety pin or tape, and the nurse will put a blanket over your baby's back. Most babies enjoy Skin2Skin, and you'll know if your baby likes it if he becomes less active and falls asleep. Usually this sleep is deeper and more restful and better for your baby's developing brain. You should be prepared to stop the Skin2Skin session if your baby starts to squirm and you can't settle him down. You'll want to check his temperature. He could be too warm. Taking off a blanket may help, or your baby may just need to change their position. If the temperature is not the problem and your baby does not settle after changing position, your baby is probably trying to tell you Skin2Skin holding is no longer relaxing. Based on your baby's condition or cues, the nurse may stop or postpone your Skin2Skin session. To put your baby back to bed, the steps are followed in reverse. If you are unable to use the standing transfer, the nurse will bring the baby to you. Thank you for watching this video. Remember, we are here to help you and your baby during this process.
Not everybody is born quote-unquote normal or typical, but there's nothing wrong with that. My name is Renee Stratton, and I am the proud parent of a NICU graduate. We were here 9 years ago. My twin girls were born 8 weeks early. I am so grateful that my nurse offered me the opportunity to do Skin2Skin care. I was able to count her little fingers and, talk to her about how I would paint her little fingernails when she was older. But doing Skin2Skin care allowed me to see her. When my nurse first told me, well, the best way to get your milk to come in is to, hold your baby and smell her blankets and, sleep with those blankets, I thought, well, how is smell going to stimulate milk production? For me, it was just, I'm going to give them the white gold. If this is what I can do to be the mother to them right now, this is what I'm going to do. You never forget the first time you hold your baby. You never do.